Hello, I'm Dr. Mohammad Fauzi mohd Sharif from Center for Sight in Malaysia. I'll be talking to you about something called age-related macular degeneration, short form ARMD or AMD. What is ARMD? It is a condition that affects the central vision of patients above 50 or 60 years old. Now, it's also a leading cause of blindness in the world, especially in the Western society, and fast becoming also in Asia. Now, how do you present with AMD? What are your signs and symptoms of AMD? Basically, first and foremost, what you will have is a reduced or loss of central vision, which can gradually or aggressively progress to forming a black central spot in which interfere with vision. There will also be some form of distortions where things or lines will appear crooked. Things that are big become small, or small may actually appear larger, and there will also be a decrease in contrast sensitivity and some loss in color sensitivity. Now, in the next slide, it can show you basically the natural history of progression of somebody who has AMD from a very normal vision to developing what we call a central scotoma and loss of central vision. AMD is affects the patient very greatly because it can affect your daily activities such as shopping, your driving, managing finances, preparing meals, and etc. Now, what are the risk factors for AMD? You can divide it basically into environmental factors, which is basically your smoking habit, poor diet, lack of exercise, and of course ultraviolet radiation and obesity. It can also be due to time, basically age, hence the name called age-related macular degeneration. And AMD or ARMD can also be inherited by genes. Generally, there are two types of ARMD, simply put called the dry type or the wet type. 90% of patients with ARMD present with the dry type. The slide shows you the appearance of this case. But the majority of loss of vision comes from the wet type. Over 80% of patients with AMD that lose their sight is in the wet type. So what we do when we have AMD and how do we treat them? Treatment for AMD actually depends on which stage and which type and how long you have had AMD or ARMD. Basically, we can give lasers which will burn out the bleeding points, or we can give a special kind of treatment called photodynamic therapy, which actually uses a different form of lasers. Or recently, we can also give some kind of medication in the eye which injected directly into your eye called anti-VEGF. One must understand that the recovery period or success in recovering vision in cases of AMD actually depends on the duration that you actually have AMD, the severity of the AMD. Some patients do not actually recover their vision fully or at all. But if that's earlier and the size is not advanced, you can recover some vision. So the most important treatment for AMD is basically preventive. You can prevent or delay the onset of AMD by not smoking, increasing exercise, losing weight, taking a proper diet. The following slide shows you certain types of diet which are good for the eye, especially those containing zinc, carotene, lutein, which have been shown to actually delay the onset of ARMD. Thank you very much.